Have you ever heard of the silent killer that strikes without warning and without apparent symptoms for months or even years? Colon cancer develops discreetly in your body, patiently waiting for you to notice its presence, but often when it's too late. More than 100,000 new cases are diagnosed each year in the United States, making this disease the third most common cancer. This alarming figure shows us the crucial importance of recognizing the warning signs that could save your life. In this essential video, we will explore in depth the 9 early symptoms that your body might be sending you. Knowing these warning signals could literally make the difference between life and death, because when detected early, colon cancer has an impressive survival rate of 95%. Stay with us until the end to discover how to identify these subtle but potentially life-saving signs that your body is trying to communicate to you. All facts presented in this video have been rigorously verified by qualified healthcare professionals to guarantee you reliable information. Your health is our absolute priority, so take a few minutes to properly inform yourself about this disease that affects 1 in 20 Americans during their lifetime. If this video is already helping you, take a second to subscribe and activate the notification bell so you don't miss any of our health tips that could save lives. Let's now dive into the first warning sign of colon cancer that you should never ignore. Sign number 1. Change in bowel habits. Did you know that the average age of colon cancer diagnosis is 60 years old? Half of the people affected are over 65 years old, but this disease can strike at any age, including young adults. Changes in your bowel habits are often the first warning signal that something is wrong with your colon. A healthy digestive system generally produces regular and predictable bowel movements, occurring daily or every other day. These stools should normally be soft, brown in color, and easy to pass without the presence of blood or particular pain. If you notice significant changes in the frequency of your trips to the bathroom, it's a signal not to be neglected. Stools that suddenly become hard and difficult to pass may indicate a potentially serious problem requiring medical attention. These changes may seem trivial, but they are sometimes the first manifestations of a tumor that is beginning to disrupt the normal functioning of your colon. Sign number 2. Persistent diarrhea. Chronic diarrhea represents a problem frequently encountered in people developing early-stage colon cancer. Technically, diarrhea is defined as when a person passes 3 or more unformed stools over a period of 24 hours. This symptom can certainly be caused by many other conditions such as irritable bowel syndrome or lactose intolerance. Inflammatory bowel diseases can also cause similar episodes of diarrhea, sometimes making differential diagnosis complex. The National Cancer Institute reports that some patients suffer from diarrhea because their colon is affected by a bacterial infection or parasitic infection. However, diarrhea that persists for several weeks without apparent cause should always prompt you to quickly consult a doctor. The persistence of this symptom, especially if accompanied by other signs, could reveal the presence of a colonic tumor at an early stage. Sign number 3. Unusual constipation. The colon plays a fundamental role in waste elimination and the absorption of water and nutrients essential to our body. When a tumor begins to develop, it can create a partial obstruction that prevents the intestinal transit from functioning properly. The immediate result is generally constipation that can prove particularly uncomfortable and disruptive to your daily life. A recent study demonstrated that more than 80% of patients diagnosed with colon cancer had previously suffered from constipation. This constipation can be caused by various factors such as medication side effects or a lack of regular physical activity. It can be difficult to distinguish between ordinary constipation and a more worrying symptom linked to early colon cancer. If your constipation persists for more than 3 consecutive days, it is strongly recommended to discuss it with your doctor. This consultation becomes even more urgent if other symptoms such as bloody stools or abdominal pain are also present. Sign number 4. Blood in the stool. Colon cancer is among the most treatable cancers when detected at an early stage of its development. The 5-year survival rate for patients diagnosed early rises remarkably to 95%, a very encouraging statistic. Unfortunately, 1 in 20 Americans will develop this disease during their lifetime, hence the critical importance of regular screening. The presence of blood in the stool constitutes one of the most significant warning signs of possible colon cancer. The colon represents the section of your digestive system that stores fecal matter before its final elimination from the body. Bloody stools can result from many medical conditions such as ulcerative colitis, diverticulitis, or hemorrhoids. Blood in the stool generally comes from inflammation or lesion located in the large intestine or other parts of the digestive tract. Certain medications such as antibiotics, notably ciprofloxacin, can also cause this worrying symptom in some people. Iron supplements or anti-diarrheal medications like lactulose are also likely to cause visible intestinal bleeding. Whatever the suspected cause, the presence of blood in your stool always warrants prompt medical consultation to determine the exact origin. Sign number 5. Rectal bleeding. Rectal bleeding can constitute a revealing sign of developing colon cancer that should never be ignored. The rectum constitutes the last portion of your large intestine, measuring about 5 inches long before the anus. This anatomical area represents the final passage of organic waste before its definitive expulsion from your body. It is important to note that rectal bleeding is relatively common and that the majority of people presenting with this symptom do not have cancer. Several other benign conditions can cause bleeding in this region, notably hemorrhoids and anal fissures. A polyp or another growth on the internal surface of your colon can also cause occasional rectal bleeding. However, any unexplained bleeding deserves thorough medical evaluation to rule out the possibility of an early malignant tumor. The color of the blood can sometimes provide clues about the origin of the bleeding and guide the initial medical diagnosis. Sign number 6. Unexplained bloating or abdominal pain. Colon cancer can be promoted by genetic factors or lifestyle habits such as diet and physical exercise. These lifestyle elements can increase your risk by up to 30% according to recent scientific research. Genetic factors represent between 10 and 15% of all colon cancer cases diagnosed each year. Other factors such as a poor diet, obesity, smoking, and excessive alcohol consumption increase this risk by 5 to 10%. Abdominal bloating is among the symptoms most frequently reported by patients with colon cancer. It can appear from the early stages of the disease or simply result from other conditions with no connection to cancer. This bloating is generally characterized by an unpleasant sensation of fullness or swelling in the abdominal region. If your stomach seems abnormally swollen after meals, try splitting your food into several small meals throughout the day. This nutritional approach can help prevent bloating due to overeating and also help stabilize your blood sugar. Persistent abdominal pain, especially if located in the lower abdomen, constitutes an additional warning signal to watch carefully. Sign number 7. Feeling of constant fatigue. The symptoms of colon cancer generally develop in a progressive and insidious manner, without really obvious warning signs. Feeling tired is a common experience that can be caused by many factors such as lack of sleep or professional overwork. However, persistent fatigue that does not improve after a good night's rest should quickly arouse your suspicions. This unexplained fatigue may signal that something is not functioning correctly in your body, particularly at the digestive level. The colon is responsible for the efficient elimination of body waste via stool to maintain the balance of your system. When this fundamental process is disrupted or slowed down, a toxic accumulation can gradually form in your digestive system. If this situation persists, it can promote the development of cancerous tumors in the intestinal wall of the colon or rectum. Chronic fatigue accompanied by other symptoms such as bloating or abdominal pain must absolutely alert you. These combined signs could indicate the early stages of colon cancer requiring immediate medical attention for an accurate diagnosis. Sign number 8. Sudden weight loss. The clinical manifestations of colon cancer vary considerably depending on the exact location of the tumor and its stage of evolution. Unexplained weight loss can constitute an early sign of colon cancer or other serious gastrointestinal pathologies. This weight loss can also occur for other reasons, especially if you are an elderly person recently recovered from an illness. It is perfectly normal to lose a few pounds during a diet or a temporary increase in your regular physical activity. However, if you have lost more than 10 to 15 pounds in a few months without logical explanation, the situation becomes concerning. This significant and involuntary weight loss could reveal the presence of colon cancer that is beginning to affect your general metabolism. Cancer cells consume enormous amounts of energy, which can lead to progressive weight loss even with normal eating. The loss of appetite often associated with the digestive disorders of colorectal cancer further accentuates this tendency toward pathological weight loss. Sign number 9. Feeling constantly full, a balanced diet can considerably reduce your risk of developing colon cancer by strengthening your immune system. However, even the healthiest eating habits might not be sufficient to completely prevent the appearance of this insidious disease. Regular physical exercise also plays a crucial role in the prevention of colorectal cancer by stimulating your natural intestinal transit. If you feel constantly full even without having eaten normally, this could signal significant digestive dysfunction. Colon cancer can cause various digestive symptoms such as bloating, constipation, and intermittent diarrhea. These digestive disorders often make it difficult for affected people to eat normally and maintain a stable body weight. These symptoms generally begin in a discrete and progressive manner, making them easy to ignore or minimize at the beginning. If you notice an early feeling of fullness accompanied by other signs such as weight loss or unexplained fatigue, be vigilant. You might think that your problems are completely different and not immediately seek appropriate medical treatment. This misinterpretation could unfortunately delay diagnosis and compromise your chances of complete and lasting recovery. Conclusion and prevention advice: whether you are 61 years old or 16 years old, the best way to prevent this formidable disease remains unchanged and accessible to all. Adopting a fiber-rich diet, practicing regular physical activity, and maintaining a normal body weight are essential. These healthy lifestyle habits effectively contribute to keeping your colon clean and significantly reducing your risk of colorectal cancer. Never forget that if you present any of the symptoms mentioned in this video, you should not wait before consulting a doctor. Keep in mind that these signs can be early indicators of colon cancer, but do not constitute definitive symptoms. If you present any of the risk factors previously mentioned, discuss with your doctor the opportunity to perform regular colonoscopies. This preventive screening remains the most effective method to quickly detect and treat possible precancerous lesions of the colon. Early detection through regular screening can literally save your life by identifying the disease at a stage where it is still easily treatable. If this video seemed useful and informative to you, don't hesitate to hit the like button to support us. Subscribe to our channel to regularly receive other health content as important and potentially life-saving as this one. We sincerely thank you for dedicating a few minutes of your precious time to watching this video today. We wish you excellent health, great prosperity, and lasting happiness in all